from the beginning of the right upper lobe is short. It's about 1.5 to 2 centimeter only. So if there is something less or large, then you suspect some anomaly also. So generally it's 1.5 to 2 centimeters. So whenever you write a report, where is the origin of right upper lobe? Just do not write 3 centimeters away from the correct. At the same time, if you think about taking the left hand lobe, it's longer. It's generally 4 centimeters in length. Therefore, you shouldn't write. If you write that, it means there is some anomaly, anomalous gradient of origin. So if there is a, you write that upper lobe bronchus, this way is the tumor. So you write the length. Where is the tumor starting from the C1 carina? So you can measure the length.
Plus carina link count.
Ring count it depends how high is the patient, what is the structure of the patient. So it's also correct. In general, one cartilage ring, for example, this cartilage is about 6 mm length. It depends. A very short patient may be 4 mm or 5 mm. So there is 6 mm length of one cartilage ring. So now let's come with the right upper lobe bronchus. So we know that our perception is the right upper lobe bronchus has got B1, B2, B3. So our perception is that all of them start at one point, like trifurcation, but that's not true. That's not the common variant. The common variant is B1 plus B2 comes together and B3 comes separately. Or one of the other options, maybe B1 and B3 are combined together. So therefore, for that purpose, we first define this is the primary carina, we call it C1. This is the secondary carina, we call it C2. At the point where the segmental bronchi start, this is the C3. And beyond that, where the subsegmental bronchi start, like the C4. So for us to define which pattern of the combination is there, so we take into account the C3 and C4 carina, right? So let's suppose in this patient, this is the upper lobe bronchus, and this is the C3 carina. So at the same point, if they are starting at the same point, then definitely this is the, we write as B1, comma, B2, comma, B3, as our mind thinks. That is a normal pattern. But let's suppose at the same point, if we draw the picture with the right upper lobe bronchus, so this is the C3 carina, now it's going like this. So this is the tertiary C3 carina, this is the C4 carina. So what's happening? This is the B1, this is the B2 and B3. So in this particular case, what has happened? Right upper lobe bronchus has divided into two segmental bronchus, two branches only. So one branch is consisting of the B1 plus 2, and the next branch B1 and plus 2, right? And the another branch is coming the B3. It means the B1 and B2 has got the common trunk. What is the importance of that? So if you planning for the segmentomy, so if you divide it here, translate it here, then it means you have to take out both B1 and B2, I mean S1 and S2 segment. So therefore, in such cases, if we can determine pre-operatively with bronchoscopy or by particular 3D reconstruction of the CT scan, we may know what's the pattern of the bronchial anatomy. In order to know that during surgery, you have to pay attention to that point. So this is one point. The next point what I was talking about, so now let's move towards the truncus intermedius. So truncus intermedius will divide into the medial lobe bronchus. So this is anterior. We rotate the patient. It's the supine posterior. Rotate the patient. The medial lobe bronchus will come towards the heart, to the anterior side. So therefore, it's the 2D picture. So we can say this is the B4. Now comes the next one is the lower lobe bronchus, right? So the medial lobe bronchus doesn't have much variation because it has only two divisions. B4 and B5, right? B4 is the lateral, B5 is the medial. So we don't take much because only two variations, two segmental bronchi are there. So we don't take much of the extension. Whatever is the region, only two segmental bronchi are there. Now coming to the lower lobe bronchus. Lower lobe bronchus has got in the right side the first branch which you will see here in the going towards this one in the B6 going towards the apex. So that will be the B6. Now there will come the common basal trunk. So common basal trunk medially will be the B7. Then you should be very particularly because the patient is lying supine like this. So this is the B6 will go like this one. In the right side B6 will go like this one, sorry, right? Then B7 will go towards the heart, here is the heart, right? B8, that is the anterobasal, will go up anteriorly. Then B9 will be in the middle and B10 will be the lowest point. It means if you draw like this, the circle, what you will see, here is the heart, this is the right side, right? And here is the heart. So what you will see, here B7 will be here, right? Then anterior will be the B8, then comes the B9, then comes the B10. So you will see particularly this variation, 8, 9, 10, right? So it will write it totally like this, it will be a little bit deviated. It means not in the parallel like direction, a little bit, not in the perpendicular direction, a little bit deflected towards the lateral side. So first will be the 8, then will be 9, then will be 10 somewhere here, right? And B7 will be the located median and B6 before that. So what happens?
So that is on the left side. If you consider on the right side,
Right side.
B7 will be on the other side, sir.
Right side, with the right side, B7 will be the medial side.
Medial side will be
medial side here. Medial side. पहले से heart and draw करा से.
Okay.
Heart and draw करा से. वो same चीज़ हो. इन्होंने bronchoscopic picture है patient like supine. Supine होता है कि B7 will be here towards the heart, medial valve, right?
No, on the right side, I need to see that.
Right side.
B7 the 9 को इतना medial गराउंड पर इतना बड़ा चित्र होगा.
This is the heart. Patient is lying supine, right? It's a supine center. Supine center. This is the heart is here. So 7th segment with the medial valve.
Yeah, exactly.
Medial heart. This is the medial side. This is one. This is the right side. I have drawn the right side. I have drawn the right side. It's not real, which we don't read in the Western book. So if we see the lower lobe bronchus, let's draw only the lower lobe bronchus. In the lower lobe bronchus, this is the B6, right? And the common basal trunks, but from the B7 we will start here, right? This is the B8, B9 and B10. This is the 2D dimensional picture you have to perceive in your mind because 8 will go upside, 10 will go the posterior, and 9 will be in between, right? So quite often what happens in about 20-25% of the cases, between the B6 and B10, let's suppose in the B10, there is another bronchus which has not been described in the Western book very often. So this is called subsuperior segment of subsuperior bronchus, which we call B star. It means if we diagrammatically, this is the right lung, this is the oblique fissure, this is the middle lobe, right? This is the horizontal fissure. So this is the 6th segment, S6. 7th will be not seen in this position because it's right medially. So this is the 8th segment, S8. This is the 9th segment, S9. And this is the 10th segment, S10, right? So in such cases where the B star exists, in such cases there is a segment part of this. This we call SS star, located between this S6 and S10, right? So this is called subsuperior segment, or if the bronchus is present, then we call the B star. Definitely if the bronchus is present, then the segment will be present. It has got its own arterial supply and it has got its venous strains. So it's also important for us. So sometimes the tumors are located here, then we can do the segmented tumor, the SS star segment. Or we can combine, generally it is combined either with the S6 or the S10 segment in vital SA. So posterior.
You take S6 or S10?
This B star segment, for example, I am drawing again. This is the upper lobe, this is the middle lobe, this is the lower lobe, this is the B6, and here is the basal trunk, this is the common basal trunk, where there will be the B10, this is the B10. So it will be located in the lateral portion of the bronchial wall. Today we also saw that they observed that the B star was located in the lateral. It's not located in the medial portion, in the lateral. It's the general location. Sometimes that will be different. For example, sometimes what we see here with the bronchus here in the medial portion, here at the region of the trunk, right main bronchus or truncus intermediate, that we call the cardial bronchus. Towards the heart side, this is the supernumary bronchus, like this one is B star, so that is also present in some of the cases. But B star is quite common. When we went to our patients also, we also found, we have not calculated, I think it's not less than 20% of the cases in our scenarios also. So it's also quite normal finding. Now let's go to another point, very important. This much was about the segmental divisions, right? So sometimes what happens, we can have the sub-segmental division also. It's also important for us. So whichever bronchus, like B1, we have got only B1A and B1B, right? B1A means lateral, B1B means
on the right side.
Sir?
On the right side,
I said, we are talking about right side, right? B1A means not only the lateral side, B1A is the proper apical, and B1B is the anterior. So it's the nomenclature. Whatever it's only type of division, okay? B2 in the right side also has got only B2A and B2B, the two divisions. B3, the right side, all we are talking about the right side. He also has got the B3A, B3B. Only two divisions. Anyway, there will be two divisions. So there's not much.
Except 6 and 10.
Yeah. Then is the B4, also B4A, B4B. B5, also B4A, B4 by B5B. B6, the right side has got three subsegments. So if we draw in this, for the our perception, this is the right side, this is the oblique feature, this is the horizontal feature, this is the segment 6, right? This one. So in the segment 6, this part, the most apical part is the S6A segment. This is the lateral because the patient is lying supine, so this is the lateral part, and that will be the medial part going behind. So this will be the lateral, this is the S6B, and this is the medial S6C, because this C segment will be going to that part. The diagram is said banako, but actually it's in that part, so it's in the medial part. So 6 segment has got A, B, 6A, B, 6. Then here comes the variation. So our assumption is that, for example, we draw the picture, this is the B6 bronchus, segmental bronchus. So our assumption is that there will be the B6A, B6B and B6C at the same point. A, B, C. That's also not true. The common pattern is that A plus B or A plus C is combined together, and the another will be going separately. So one of the combination will exist like B6A
plus B,
B6C. One of the patterns variations. So this we have to also know during the segmentectomies or subsegmentectomy, whatever you do. So this is also important for us to know. So it was in the right side. So right side is clear. Any key questions on right side? Okay. Then we are coming to the B7. B7 is also having the B7A and B. B8 is also having A and B. B9 is also having A and B. But B10 again 3 subsegments. B10A, B10B, B10C. But in the 10th segment, as I showed you today during the bronchoscopy,
10A, B plus C.
10A means most posterior is going. Okay, most posterior going. So we saw during the bronchoscopy. So if there is the 10th segment, in the right supine position, there is the B10 bronchus, segmental bronchus. So B10A will be the most posterior. One will be the B10B, that is the lateral, and B10C will be the medial. This combination will happen. So this will also look like tripartite. There will be some of the variations, some of the combinations, right? 10A will be the most posterior one. B10B will be the lateral. B10C will be the medial. So again, this is also important for us. So that's why important, because when you read the CT scan, in the proper CT scan, then you must be able, if somebody asks, what is the exact location of the GTO? What's the exact location of the 8 millimeter nodule that we see in the CT scan? For 8 millimeter nodule or 1 centimeter, you can consider the segmental. Or if sometimes what happens, like suppose this particular case, the nodule is this S10, right? This is the S10, this is the S10A, this is the S10B, this is the S10C, right? 10. So let's suppose the nodule is 1 centimeter diameter, but it's located here in the segment S6C. Okay? But it's very close to the intersegmental plane, right? Just 6 S10A close. So if you consider the segmentectomy, as per the protocol, if it's 1 centimeter, you can consider the segmentectomy. It is equivalent in the oncological principles till it is the anterior status, right? So you can consider segment, you don't need to consider for the lobectomy. But if it is very close to the intersegmental plane, then the margin will be compromised if you are carrying out S6 segmentectomy, right? Because by virtue, you have to take the double the size of the margin or at least 2 centimeter tumor-free margin. So if it is 1 centimeter only to the, so if you go take the 2 centimeter margin, it will dip inside the S10C, S10A, right? So in such cases, you have to, if you need to consider the segmentectomy, then either you have to take out the S6 segment plus S10A, right? Or you can combine only take the S6C segment, subsegment, plus S10A subsegment, right? You will have the margin enough function. So these are the, but what's the difference? Here you are taking out the subsegment of 2 different segments. We are taking out one of the subsegment of S6 and one of the subsegment of the S10. But still you can preserve the lung organ. You don't need to carry out the lobectomy. So here lies the importance of knowing about the subsegments and also subsegmental anatomy of the arteries, subsegmental anatomy of the bronchus and the veins. So that's also very important for us. So this was about the right side. Now let's come to the left
So
side.
इसमें भी start about this to organize the
Left side particularly, again reminding, recalling all the things that we have been doing the bronchoscopy always. We'll see the left side, it has got the left upper lobe bronchus and left lower lobe bronchus, right? Left upper lower lobe bronchus will have the superior division and inferior division. Superior division, inferior division. Superior division will be having the B1 plus 2 and B3, right? This is the B1 plus 2 and this is the B3. The inferior division will have the superior lingular bronchus B4 and inferior lingular bronchus B5, right? This one. The lower lobe, in the left side, we don't have the medial B7 segment because it is combined filled with B8. So therefore, it will be the anteriormost part of the B8, the lateral part of the B9, and the posterior value will be the B10. So what happens in the left side, if you see this pattern, so if you draw the circle, but in the left side, so this will be the 8th segment, okay? This will be the 9th segment, and this will be the 10th segment. During the bronchoscopy, like we will visualize today in the morning, so it will go like this: 8, 9, 10. So this will be
to later.
Yes, I did. Take a perpendicular. The only difference is now let's come in the left side. It's much more complicated than the right side because we don't have the middle lobe. The lingula is supposed to be the equivalent to the middle lobe in the right side. So in this one, B1 plus 2 has also got 3 trifurcation A, B, and C. See, it should be also very also clear. A means the proper apical that goes to the upside, like in the right side. Okay. B means which will be going posteriorly, and C means it will be looking laterally. So if you draw the picture, like in the left one, we don't have the horizontal, this is the oblique picture. So this part will be the S1 plus 2 segment, right? S1 plus 2. This will be the S3 segment. This one will be the S4 and this one will be the S5 segment, right? In the left side. So now we are talking about the S1 plus 2. So this particular part will be the S1 plus 2A, which will be located up.
Most difficult.
S1 plus 2B will be going posteriorly, and this much part will be located laterally, which will be S1 plus 2C. Except during the diagrammatic representation, you have to plug. So if you tilt the patient like that, you do the surgery in the lateral position. So S1 plus 2C will be located laterally, S1 plus 2B from this side, if I look at it here, you cannot see S1 plus 2B because it's located behind.
We have to pull it.
Isn't it? So in order to visualize that surface, you have to pull the line like this, then only you can visualize S1 plus 2B. Which is a clear one. So, हामीले गर्दाखेरि you have to have a clear mental planes. You have to imagine, or you have to follow some landmarks like Venus anatomy. Generally, हामीले के बुझ्यो भने we can have during the surgery, we can have two kinds of things, assumptions. Right? One assumption is, let's draw it in the right side for me. The right side is easier. So, like this one, right? So this, for example, this is the S1 segment. How will you define the boundaries? This is the S1, this is the S3 and S2. How will you define the boundaries between S1 and S3, S1 and S2? How? You don't see inside the lung anything, right? You don't see clearly. So for that, we have the two things. One thing you must remember, in the center of a segment, always there will be entering the artery and the bronchus. They will be entering together in the center of a segment. So if this is the segment, like we draw this here, this is the conical segment S1. So from the apex, there will be the entrance of the artery and there will be the entrance of the bronchus, right? So there will be the B1 and this will be the A1. They will be entered and you will locate it in the center of the segment. But at the same point, at the same time, the veins will be going to the boundaries of the segment. But the veins are also different. For example, if we see particular veins, let's suppose our assumption is A1 is the arterial supply of the S1, and A1 means the apical artery. Then we think that venous drainage will be also B1, but that's not true. what happens B1, I mean is the superior pulmonary vein. It has got the V1, it has got the central vein, it has got the medial vein, right? So this B1 will have the two divisions, B1A and B1B. This is the B1B, this is the B1. It means that B1A will go inside intrasegmental, this is the, then that will demarcate the segment, demarcation between S1 and here will be the S3. अब बुझ्यो भनेर चाहिँ S1 को भित्र B1 को V1 A मात्रै आउँछ but V1 B लाई फलो गर्यो भने that will show the demarc boundary between the S1 segment and S3 segment. So that is the way that you can find. So the presumptive के हो भने if you find out this way, it will be very classical. You can define the boundary very well. Or if you find out the artery and vein, you clamp the bronchus through the inflation wrist, then this part will be either deflated or inflated. The rest of the lung will be just opposing. So that you can see the boundaries. Or you can do the ICG test like in the liver, then the vascular supply of this will be gone. The rest of will be highlighted by ICG. This segment will be not highlighted by ICG. So in that part, in that way, you can define the boundaries. So there are different ways of defining the boundaries. So one of the easiest way is, rather it's a bit difficult conversion sometimes because of the regions and nodes to define out the boundary of the vein. So in those cases, you can define by inflation deflation test. Once you like it, the artery which you clamp the bronchus, then you can define what's the boundary. So if you come to the left side, so we talked about the B1 plus B A, B, C. Similarly, B3 has also got B3A, B3B, B3C. But here a little bit difference in there. So we draw again the picture. This is the left one. This is the oblique feature. So I said this is the S1 plus 2. This is the S3. This is the S4 and this is the S5. Okay. So S3 segment has got three subsegments I told you before. So we divide like this. This is the S3A, the lateral. S3B is the medial, and S3C is the superior. Therefore, what we did today in the bronchus, it was very clear. Okay? We saw actually where there B3A, B3B, and B3C. So this is about the F3 segment, right? S4 and S5 is very clear. Our B4 divides vector because it has got only A and B. D5 has also got only A and B, so there is not much difference in there. So far as this part is for the lower lobe bronchus. The lower bronchus has the B6 will realize here somewhere, right? And there's the common background. The B6 also has the three subsegments, like in the right side. So B6 will also have A, B, C. A means the apical, proper. B means the lateral, and C means the medial. Then similarly, there was 8, 9, 10. Now in this position also, let's suppose this is the trachea, this is the left lung bronchus, this is the upper lobe bronchus, the lower lobe bronchus, this is the B6, this is the basal trunk, this is the B10, right? This is the B9, this is the B8, right? So this is the B6. Is somewhere here, if you some opening during the bronchus, that would be called the green sharp. Same like in the right side, in the left side also you can see the same thing. So this is the importance of the B star. And also in the same way, B6 has also three divisions, subsegments. B8 has only B and A, B and B. B9 also has A and B. But B10 again, like in the right side, we have got the A, B, C. A means posterior, B means lateral, C means middle. This was about the bronchial anatomy that you have to visualize through the bronchoscope. Any questions? That was the